I grew up as a musician, actually. Played classical string bass for 20-some years. And suddenly got a lightning bolt that said I should go into medicine. And that's how it ended up in medical school. Through my training and medical school all through residency, I'm also more of I look at the whole patient as a person, not as a disease. So if they say they're having issues, then I try to figure out, okay, how's that issue interacting with all of their life, their business, their home, their kids, everything. Some of the patients we'll see once or twice and then they're gone back to their primary care. Some of our patients, like our gastroparesis patients specifically for me, once they become in our clinic, we're pretty much taking over. But we have our Crohn's patients and our ulcerative colitis patients, our hepatitis patients. Those are patients we're going to see repeatedly. Some of the patients, they have acid reflux, we'll treat them and send them back to their primary care. Or somebody getting a colonoscopy, they'll come in, get the scope, and then go back. Gastroparesis is basically when the stomach doesn't empty well. Can be a sign of worse problems in the whole intestine, where the whole intestine doesn't work right. Most of the time, a lot of those patients are diabetic. That's one of the biggest categories. What we developed here, and I actually developed it with one of my surgeon cohorts, it was the first of its kind. It's a multidisciplinary clinic where it's myself, surgery, pain management, we have nutrition, all in one location. Patients will come into me and they'll go, "You're the first person that's even given us a chance." Most of the time they go to the doctors and the doctor goes, "There's nothing we can do for you." Part of it is because, again, they're not trained in it, so they're not familiar with all the medicines that are out there. We don't have a lot of medicines to use at the present time, but that'll get better. I have a farm. I farm 36 acres. We raise beef cows and horses and anything else you want to talk about. We raise donkeys. We have a donkey my wife rescued. We raise pigs and chickens and goats and lambs, and that's a full-time job. That's a hobby, actually. And I restore old trucks. So.